Good afternoon, Miss B. How are ya? I see your husband's here. He made it just in time. I have all of your discharge instructions here with me. I also have copies of everything for you to take home so you don't have to write anything down or try to remember it all. It is a lot of information. So if you have any questions while we're going through it, please stop me and ask the question so you don't forget. Um, so if you guys are ready, we'll go ahead and get started. Great. So the first thing we're going to talk about is just a little bit of what brought you in here. So you're 59. And you came into the emergency room complaining of some tingling and numbness on the right side of your face and unable to keep your right eye open, correct? Great. All right. So, um, in the emergency room note, it looks like you appeared to have a slight right-sided facial droop and weakness to your right side, your arm, your legs. Um, so you had a CAT scan and an MRI, both of which were negative for anything. You seen Dr. Rudenko, the neurologist, and he diagnosed you with having a stroke that didn't show up on the testing. So, an ischemic stroke occurs when an artery that supplies blood to the brain is blocked by a blood clot or fatty buildup called plaque. Risk factors for this include high blood pressure, and cholesterol, both of which that you have. I believe you have been on medication for your blood pressure and your cholesterol at home, correct? All right. Your blood pressure is staying within normal limits at home? Good. Um, so along with that history, you also have two rare disorders, one being May-Turner syndrome and one being fibromuscular dysplasia. May-Turner syndrome is a rare vascular disorder in which your artery compresses a vein in your pelvis. This could cause blood clots, and symptoms can be seen in your left leg or foot and right leg or foot. Whichever side the vein is compressed. Your fibromuscular dysplasia, which is what they think caused your stroke, that's what they're pinning it to. This is a condition that causes some narrowing and enlargement of your arteries in your body. When arteries become narrow, this reduces the blood flow and can affect the organs that that artery is leading to. It appears most commonly in the arteries leading to the kidneys or the brain, for your instance. And it can affect other arteries such as your legs, your heart, the other arteries leading to your legs, your heart, your abdomen, and your arms, but that's more rare. And you can have more than one affected artery at a time. Do you have any questions of that or anything you want to add? All right, so we'll move on to your medications. So I believe three of these medications you were taking at home, and we'll just go over them just to refresh your memory. Like I said, I do have a printout here with the times you're supposed to take them, if you should take them with any food or anything like that for you to take home with you. All right. So we're going to start. So you're going home on Synthroid, which you were taking before, Lipitor, which you were taking before, and Cozar, which you were taking before. You do have two new medications, one being aspirin, a baby aspirin, and one being Plavix. So we'll start with the ones that you already had at home and go through them first. So the first one is Synthroid. Another name for this is levothyroxine. You're going to take 25 micrograms once a day in the morning. This needs to be taken 1 hour before any other medications or food. This is a type of hormone, and it was ordered for you because your thyroid levels were a little low. You should avoid taking it with the food or other medicines because this decreases the absorption of the medication. So things like avoiding grapefruit, Um, any foods or supplements containing large amounts of calcium, iron, magnesium, or zinc. Those supplements bind to this medication and prevent complete absorption. Other things like Tums or pantoprazole. I'm not sure if you know what that one is. Pantoprazole is a medicine people take for their stomach. Another word for that's Protonix. Things to notify your primary care provider about if you begin having headaches, feelings of nervousness or increased pulse rate, chest pain, excessive sweating or heat intolerance that's different than normal, feeling like your heart's skipping a beat, or any weight loss greater than 2 pounds per week. And make sure your primary care doctor is having your thyroid levels drawn regularly. Normally, they shoot for about every 6 months. Any questions about that medicine? All right, so we will move on to Lipitor. So Lipitor is also called atorvastatin. This is a lipid-lowering agent, which lipids are your cholesterol. You're going to take 40 milligrams once a day in the evening or at bedtime. So cholesterol is what makes up your plaque, which makes up the blood clots. This was prescribed because they want your bad cholesterol to be below 70 if you've had a stroke. Yours was at 91. So they want to try to get your bad cholesterol below 70. This medication should be taken at bedtime to increase absorption rates through the night. They increase. You should notify your doctor if you start having any unexplained muscle pains, tenderness, or weakness, especially if you begin to have any fever or just feelings of being unwell with it. You also need to watch for any signs and symptoms of a liver injury, which include feelings of fatigue, right upper abdominal discomfort, dark urine, jaundice, and if you start having any anorexia signs. Also, along with this medication, you should have diet restrictions in place also. So a diet low in fat, cholesterol, and carbohydrates, and avoiding alcohol. Any questions with that medication? All right, we'll move on to your blood pressure medicine. Cozar, it's also called losartan. You're going to take 25 milligrams once a day. You can take this in the morning or the evening. They prefer you to take it in the morning. So this medication treats high blood pressure. So what it does is it blocks constriction of your vessels, which lets the blood pressure drop. So before taking this medicine, you should take your blood pressure and pulse manually before taking. So do you know how to take your blood pressure and your pulse manually? You have an automatic blood pressure machine. Okay, and you have a thing that goes on your finger, pulse ox for your pulse. Okay, great. So when you're going to take them, make sure you sit down in a chair, relax for about 5 minutes before you start taking your blood pressure, your pulse. Make sure your blood pressure cuff is at heart level, and make sure that you're not talking. So while taking this medication, if you start having any episodes of dizziness that's excessive, any consistently low blood pressures, you should be keeping a blood pressure log while you're taking these medications. So if you have consistent low blood pressures, make sure you bring that up to your doctor. They may need to decrease your dose or change you to a different medication. Any headache, shortness of breath, or generalized swelling in your face area, your eyes, your lips, anything like that. While taking this medicine, you should avoid salt substitutes and you should be on a low sodium diet. Avoid foods containing high levels of potassium. And you should continue taking even if your blood pressure goes to a normal level. You need to keep taking the medication because this is what's keeping our blood pressure normal. Also, while taking this medicine, avoid sudden position changes. If you stand up, you could get dizzy and fall, lightheaded, anything like that. Do you have any questions about that one? I know you're familiar with those three that we just went over, but anything you can think of? Great. All right, we're going to move to your two new medications. So both of these are blood thinners. So the first one we're going to go over is called Plavix. Another name for that is clopidogrel, Clopidegrel. So you're going to take this once a day, 75 milligrams. You can take it in the morning or the evening, whichever best suits you, and you can take it with or without food. It does not matter. But you do need to take it at the same time every day, and do not stop taking this medication abruptly without consulting your provider first. So this medication is an antiplatelet medication. So normally platelets bind to your red blood cells, making them stick together. So it decreases your risk of bleeding, but it increases your risk of blood clots. So Plavix decreases this action, causing your blood to be thin. So you are at an increased risk for bleeding, but it decreases the formation of any blood clots. And with your two existing conditions, you're at a higher risk for blood clots. So I'm surprised you weren't taking this before this. So you need to monitor for bleeding. So watch your stools. Any stools that are black and tarry, notify your doctor. If you have an injury that won't stop bleeding, apply pressure. Go to the emergency room if you're having trouble with it. Stop bleeding. This medication does need to be stopped if you are getting ready to have a surgery or a procedure. So whoever's going to be taking care of that surgery or procedure, let them know that you're taking this medicine so they can give you instructions on when to stop taking it. Normally it's 5 to 7 days before, but in some instances it can be different. Just be aware with this medicine, you can have increased bruising, your skin can tear easily, you can bleed a lot easier, even just bumping a table, you can start bleeding. Any questions with that medicine? Yeah, so other signs of bleeding, other than watching your stool, is if you start vomiting, any black vomit, anything like that. So also watching your urine for any blood in your urine, or coughing up any blood. Those symptoms. Any questions about the Plavix? All right. So the last one we're going to talk about is your aspirin. It's a baby aspirin. You're going to take 81 milligrams once a day. You need to take it after meals or with food. Sometimes it can irritate your stomach. Make sure you take it with one full 8-ounce glass of water, and remain upright for at least 15 to 30 minutes after taking. So this medication works just like Plavix. A lot of people have myths of using aspirin for pain, and that is not. Today it's just used for a blood thinner type. So while taking this, you also need to watch for signs of bleeding. Also, watch for if you have any excessive ringing in your ears, you need to let your primary care provider know immediately. You need to take this, sorry, I already said that, with a full glass of water. If you notice any unusual bleeding of your gums while you're brushing your teeth or eating certain foods, any bruising that is excessive with both of these medications, you are going to bruise easier, like I said before. Just watch for anything excessive. Again, black tarry stools, any vomit that looks like coffee grounds, you need to go to the emergency room immediately, and watch for any fever lasting longer than 3 days. While taking this, you need to avoid irritating foods, avoid alcohol. These things, along with this medication, will severely irritate your stomach. This medication also needs held before a procedure or surgery. Normally it's 1 week, but just like Plavix, let the person that's taking care of your surgery know so they can instruct you on when to stop taking it or if you need to stop taking it. Any questions about your medication? All right. So we are going to move on to activities at home. So when you go home, you can return to your normal activities. You don't have any limitations, but you need to be aware that things that you used to do before may be a little bit more difficult to do now with your weakness on your right side. It might take a while to get back to be able to do them, or you might have to find alternate ways to complete the um, task. Um, So you just need to be careful not to overexert yourself. You can work yourself up to your um, threshold, I guess you could say, but you need to allow for rest periods, take frequent rest periods, stay hydrated. Um, so since you do have some weakness in your legs, you're at a higher risk for falls. So your husband might want to go home and try to make your home a little bit more safer. So if you have throw rugs, pull them up. You may need to add grab bars in the bathroom near the toilet or in the shower. You may need to have a shower seat. Um, don't wear socks on hardwood floor. You need to wear slippers with the grips on the bottom or socks with the grips on the bottom. Avoid things that are going to potentially cause you to trip and fall. Another thing is you need to teach your family ways to keep an eye on you for another stroke. So since you've already had a stroke, you are at a higher risk for having another stroke. So I'm going to teach this to you and your husband, but when you go home, you do need to tell this to your kids, anybody that's around you, just so they know. So the acronym to remember is FAST, F-A-S-T. And I do have a whole brochure here explaining that for you. So the F stands for facial droop. So you do already have a slight facial droop on your right side. So basically what this means is if your family notices it getting worse or if the other side begins to droop. The A stands for arm weakness. So if you hold your arms out straight, if one tends to drift or you can't hold one up. S stands for slurred speech. So if you begin having your speech is slurred, kind of like a word salad where you can't make up a full sentence or you can't get your basically you can't get your brain to connect to your mouth muscles to where you can't say what you want to. And T stands for time. So that means time to call 911. So if you have those symptoms or one of those symptoms, you need to call 911 and get to the emergency room as fast as you can. If you have any questions about your other limitations or activities, you can direct them with, you're going home with PT and physical therapy and occupational therapy, right? So you can direct that with them or your primary care provider. From our standpoint, we don't have any limitations. Just getting yourself back to your baseline is our priority. Next thing we're going to move on to is I know you had some trouble in here swallowing, and you were seen by speech therapy, right? And she said everything was okay to go back to normal. Okay, good. So, but you still have trouble feeling like there's kind of food stuck in your throat? All right. So, your stroke may have caused some weakness or other issues with your swallowing, your esophagus. So if you continue to have these issues, bring it up to your doctor. You may need seen again. I know you had the barium swallow and everything went okay. We just need to monitor this. Other things that you can do to help um, make this a little bit easier is eating small meals more often throughout the day. Sometimes the eating large meals at one time can cause some reflux, especially with you already feeling like there's food stuck in your throat. That would be very uncomfortable. So small meals more often through the day than large. Make sure you chew your food up slowly and very thorough, fine. Make it easy to swallow. Um, Avoid hard foods like steak, things that take a lot of chewing, tough stuff, raw fruits, vegetables, crunchy cereals, anything like that. Make sure you're drinking plenty of fluids, as I said before, to avoid dehydration. And make sure you're sitting upright to eat. That's the big thing to prevent choking. Any questions with any of that? All right. So we're going to move on to health promotion, which is ways to keep yourself healthy. So we're going to start with things like foods. So being a stroke patient, there is not a stroke diet that you should follow, but there are foods that you should avoid, or foods that you should kind of stick to while after having a stroke. That goes along with the cholesterol stuff. Um, so you should avoid things like highly processed foods and deli meats. They can be high in sodium. Avoid alcohol, especially. Um, I know you said you weren't a smoker, but avoid tobacco. Avoid avoid foods high in saturated fats, things like fried foods, hot wings, those type of things. Try to eat more fresh fruits and vegetables and stay hydrated, like I said before. We're going to get more into the specific of the fruits and vegetables here in a minute. And avoiding foods that don't contain a lot of fat, should be rich in carbohydrates, getting a lot of vitamins and nutrients. So the foods include, for fruits and vegetables, you need to aim for at least 5 servings per day. And these fruits and vegetables should be fiber rich and low cholesterol. These can help manage your blood sugar levels. The lower cholesterol helps keep your blood pressure low, decreasing the plaque buildup. And fiber rich just increases GI motility, getting you the nutrients that you need. Other things are whole grains. So choosing whole grain breads and cereals, pastas and rice instead of the refined grains. The whole grains provide more fiber also and nutrients than the refined, or some people call them fake grains. Lean protein. So eating lean protein can help build your muscle and your tissue back up. So that'd be good to have to help with your physical therapy and occupational therapy visits to help build your muscle. So good sources of lean protein include chicken, fish, tofu, legumes, and eggs. And it's recommended you eat 1 gram of protein for every 1 kilogram of muscle to build your body. So things like red meats aren't really recommended, I guess you would say. Low fat dairy. So dairy products you should be choosing low fat or fat free options instead of the whole milk or 2% milk, the cheeses, all those things. Um, those options help limit your saturated fat and your cholesterol. Healthy fats include olive oil, nuts, avocados. These fats help improve cholesterol levels and reduce any inflammation. So, our habits greatly influence our lives. Removing fatty foods and starting to exercise more can just help decrease exercising can help decrease your blood pressure and your cholesterol levels, blood sugar levels, all those things just in that in itself. As you exercise more, things will become easier for you to do, such as walking up steps or anything like that. Um, Other things that people don't think of, you need to avoid fast food. Fast food's really high in fats and cholesterols and sodiums and all that thing. So things like McDonald's, Burger King, things like that. I know that was a lot of information, and like I said, I have a paper here for you to go through. Do you have any questions about any of those foods? All right, and last thing is to have your primary care provider monitor all your labs routinely. Like I said before, keeping a blood pressure log and a heart rate log, labs to watch your kidney functions and your cholesterol levels, keeping your blood pressure within normal range, following a 2-gram salt restriction per day, and no fake salt substitutes, things like that. Um, I think that's all. Do you have any questions for me? All right, and I'll go ahead and give all these here to you. I'll go ahead and go get a wheelchair for you to take you out. I'll give you these papers while I'm getting a wheelchair if you want to look over anything. If you have any questions before we go out, you can certainly ask me. And it was a pleasure taking care of you. I will go get the wheelchair. Thank you very much.